I'm going to go ahead and call to order the Senate Committee on Health and Human Services for Thursday, May 13th with a roll call.
Senator Hardy? Here. Senator Harris? Here. Senator Kiekefer? Senator Spearman? Chair Ratty?
Here. All right, a little unusual to do a work session without all of our members here, but I will give the members who are absent today the opportunity to come and record their vote if they would like. Otherwise, it's a deadline week and we need to keep moving, so we're going to keep moving. We are going to start with the work session, and then after we complete the work session, we will have a bill presentation on SB 424. So, Ms. Kamlasi, if you would take us through the work session.
Thank you, Madam Chair. Megan Kamlasi for the record. The first bill on work session is Senate Bill 438. We heard this bill on Tuesday, May 11th. Senate Bill 438 provides that the State Department of Agriculture adopts by reference certain federal regulations related to standards for growing, harvesting, packing, and holding produce intended for human consumption. The bill further requires the department to inspect farms required to comply with these regulations. The state quarantine officer must issue cease and desist orders and orders to recall produce, if appropriate, to a person who provides produce that creates an immediate food safety risk in violation of federal regulations, or who fails to resolve repeated violations of federal regulations. Finally, the department may adopt regulations to carry out these duties, and no amendments were proposed for this measure.
Thank you, Ms. Kamlasi. Any clarifying questions from the committee? Seeing none, I'd be looking for a motion of due pass. Due pass from Senator Harris, second from Senator Hardy. Any discussion? Seeing none, all those in favor signify by saying aye. Aye. Any opposed? Motion passes unanimously. And I will go ahead and assign that floor, assign the floor statement to Senator Hardy.
The second bill on work session is Assembly Bill 178. It was heard in committee on April 29th. Assembly Bill 178 requires insurers, including Medicaid, the Public Employees Benefits Program, and local governments that provide coverage for their employees, to waive any restrictions on the time period within which a prescription may be refilled for an insured who resides in the area to which a state of emergency or declaration of disaster applies, if the insured requests the refill within a certain time, and to authorize payment for a supply of a covered prescription drug for up to 30 days for any insured who requests a refill under these conditions. The Commissioner of Insurance is authorized to extend these time periods as he or she determines necessary. The measure allows a pharmacist to fill or refill a prescription in an amount that is greater than the amount authorized by the prescribing practitioner, but does not exceed a 30-day supply of the drug if the drug is not a controlled substance listed in Schedule 2, the patient resided in an area where a state of emergency or declared disaster applies, and certain other requirements are met. A pharmacist who dispenses a drug under these conditions must issue and maintain a written order for dispensing the drug and notify the practitioner. And no amendments were proposed for this measure.
All right. Any clarifying questions? Seeing none, looking for a motion? Due pass from Senator Hardy. Second from Senator Harris. Any discussion? Seeing none, all those in favor signify by saying aye. Aye. Motion passes unanimously. Senator Hardy, it looks like you're a sponsor on this one. Would you take the floor statement?
Assembly Bill 197 is next. It was heard on April 27th. Megan Kamlasi for the record. AB 197 authorizes minors who demonstrate that they live apart from their parents or legal guardian to consent to certain health services for themselves or their children. The bill removes the requirement that minors must have lived apart from their parents or legal guardian for at least 4 months. It prohibits delaying or denying health services to a minor who refuses to consent to communication with a parent or legal guardian, and provides that a parent, legal guardian, or legal custodian of a minor receiving certain treatment is not responsible for paying the cost of the treatment unless the parent, guardian, or custodian has consented to such treatment. Finally, AB 197 revises provisions that require the state registrar to provide birth certificates to a homeless person free of charge in certain circumstances by removing a requirement that the person must submit a signed affidavit stating that the person is homeless. Instead, a person needs to sign a statement under penalty of perjury that he or she is homeless. The state registrar may not require such a statement to be notarized, and no amendments were proposed for this measure.
Thank you. We are on work session on Senate Bill 197. Thank you for that explanation, Ms. Kamlasi. Any clarifying questions? Seeing none, I would take a motion.
Is that an amended due pass, Chair?
Just a due pass.
I move to due pass.
Due pass from Senator Harris, second from Senator Spearman. Any discussion? Seeing none, all those in favor signify by saying aye. Aye. Any opposed? Senator Harris, would you take the floor statement on that one?
Be happy to.
Thank you.
Assembly Bill 205 is next. Megan Kamlasi for the record. This bill was heard on May 4th. Assembly Bill 205 authorizes a school nurse or other designated school employee who's properly trained to administer an opioid antagonist to any person on the premises of the school who is reasonably believed to be experiencing an opioid-related overdose. It outlines additional requirements related to those provisions, and the bill provides that a healthcare professional is not subject to disciplinary action for issuing an order for opioid antagonist to a school, and it exempts a school, school district, employee of a school, registered pharmacist, healthcare professional, and various other people from liability for certain damages relating to the provision or administration of an auto-injectable epinephrine or an opioid antagonist under certain circumstances, and no amendments were proposed for this measure.
Anybody have any clarifying questions? Seeing none, all those in favor signify by saying aye. Aye. Any opposed? No. All right, let's try that again. Motion from Senator Harris. Second from Senator Spearman. All those in favor?
Aye.
Aye. Any opposed? Motion passes unanimously. Thank you. Yeah.
Megan Kamlasi for the record. Assembly Bill 228 is up next. This was heard in committee on April 29th. The bill provides for the establishment of children's advocacy centers where multidisciplinary teams work to investigate and help children recover from abuse and neglect and hold accountable perpetrators of child abuse and neglect. The bill outlines credentialing and operational requirements of these centers. In addition, the bill requires the governing body of each county and child welfare agency to ensure, to the extent that money is available, that children who are victims of abuse or neglect have access to the services provided through a children's advocacy center. And it creates the account to support children's advocacy centers in the state general fund administered by the Division of Child and Family Services of the Department of Health and Human Services. And no amendments were proposed for this measure.
All right, any clarifying questions on this one? Seeing none, looking for a motion. Senator Spearman, second from Senator Hardy. Any discussion? Seeing none, all those in favor signify by saying aye. Aye. Any opposed? Senator Spearman, would you take that one on the floor?
Assembly Bill 278 is up next. This bill was heard on May 6th and requires the Department of Health and Human Services to develop and make available to the Board of Medical Examiners and the State Board of Osteopathic Medicine a data request to be administered to applicants for the renewal of a license or a biennial registration. The data request must solicit certain information about the practice of the applicant, and applicants must respond to this request but are not subject to disciplinary action by the board for refusal or failure to complete it. The department must collect and maintain the confidential information received from applicants and prepare an annual report relating to the data received, and no amendments were proposed.
Thank you. Any clarifying questions on this one? Seeing none, motion to approve by Senator Hardy, do pass. Senator Hardy, second Senator Spearman. Any discussion? Seeing none, all those in favor signify by saying aye. Aye. Any opposed? Motion passes unanimously.
Assembly Bill 287 is next. This bill was heard in committee on May 6th. Assembly Bill 287 provides for the licensure of freestanding birthing centers through the State Board of Health, Division of Public Behavioral Health of the Department of Health and Human Services, and it requires the board to adopt regulations necessary to provide for such licensure. It outlines various requirements related to freestanding birthing centers, and also the bill replaces the term mother with references to a person who is pregnant, a person giving birth, a person who gave birth, or a person who has given birth for purposes related to vital statistics, maternal and child health, and medical facilities and related entities. Following the bill hearing, Assemblywoman Monroe Moreno submitted a conceptual amendment, which is listed on the bill page, and it is to amend the bill such that freestanding birthing centers replace obstetric centers as a type of medical facility that is licensed and regulated in accordance with Section 12 of the bill.
This is one that had a amendment that came in yesterday. I want to make sure that everybody had the opportunity to see it, take a look at it, and if there's anybody who had any clarifying questions. Senator Hardy?
Thank you, Madam Chair. I have, for lack of a better way of saying it, major issues with the bill and how it's been amended. I think it's a disservice to change the word mother. I think the bill with looking at a birthing center has some merit, particularly if it was in a BIPOC community with the zip code that would create a nidus for growth of the medical field in a medical desert, as it were. I think where it's going with all of the things, the moving pieces, not the least of which is getting rid of mothers or pretending to get rid of mothers. I have strong feelings about this bill. I will be a resounding no. Thank you, Madam Chair.
Okay. Anybody else have any clarifying questions or comments before we seek a motion? All right. Looking for a motion of amend do pass.
So moved.
Amend do pass from Senator Harris, seconded from Senator Spearman. Any further discussion? All those in favor signify by saying aye. Aye. Nay?
Nay.
So that would be Senators Harris, Spearman, and Ratty in favor, Senator Hardy opposed. Motion passes. All right, we'll move on. Oh, sorry. Senator Spearman will take the floor statement.
Megan Kamlasi for the record. The next bill is Assembly Bill 326. It was heard in committee on May 6th. This bill makes various changes related to cannabis. It authorizes a district attorney or a city attorney to bring a civil action against a person who engages in certain activities relating to cannabis without the required license or registration card issued by the Cannabis Compliance Board. The board must adopt regulations prescribing procedures and requirements by which a court-appointed receiver may take possession of, manage the operations of, and take any other action authorized by the court with respect to a cannabis establishment. The board is authorized to adopt regulations to give priority to a transfer of a license to another party who is qualified to hold such a license if the transfer is subject to a receivership, involved in a recapitalization, or party to a court proceeding involving financial distress. Additionally, the bill requires that all advertising by a cannabis establishment contain the name of the cannabis establishment and the adult use cannabis establishment license number or other unique identifier, or the medical cannabis established license number or other unique identifier of the cannabis establishment. Assemblyman Roberts proposed the attached amendment and the amendment below during the bill hearing. The amendment on the bill page is simply to add the word advertised to the list of actions for which a person who does not hold a license and engages in is liable for a civil penalty of not more than $50,000.
Okay. Anybody have any clarifying questions on this one? Seeing none, I would look for an amend do pass.
So moved.
Amend do pass by Senator Harris, seconded by Senator Spearman. Any further discussion? Seeing none, all those in favor signify by saying aye. Aye. Any opposed? Motion passes unanimously. Senator Spearman, going for the win on puns for today, says we should not be getting too far into the weeds. Thank you, Senator Spearman. And with that, she has earned the floor statement.
Assembly Bill 343 is up next. This bill was heard on May 11th. It requires the Regional Transportation Commission in a county whose population is 100,000 or more, in collaboration with various other state and local agencies, to develop a written plan for conducting walking audits of urbanized areas within the county to assess a variety of factors. The plan must be submitted to the respective district health department and the Legislative Committee on Healthcare no later than June 1st, 2022. And David Clyde, General Counsel of the Regional Transportation Commission of Southern Nevada, proposed the attached amendment during the bill hearing.
Any clarifying questions from anyone? Senator Spearman.
Yeah, thank you, Madam Chair. And I guess I don't know that so much it's a question, but I'm really glad to see this. I don't think most of the sidewalks in places where we got the Popcat are not ADA accessible. I've seen people in wheelchairs, and the people who are with them, whoever's with them, the wheelchair is on the sidewalk, and the other person is in the street, or either trying to walk behind because the sidewalks aren't lost. So this is a bill long overdue.
Okay. Any other questions or comments? Seeing none, I would be looking for a motion to amend do pass from Senator Spearman, second, Senator Hardy. Any discussion? Seeing none, all those in favor signify by saying aye. Aye. Any opposed? Motion passes unanimously, and Senator Spearman, it looks like you have some enthusiasm for this bill, so I'll ask you to take the floor statement.
Assembly Bill 344 is next. It was heard on April 27th. This bill authorizes the Aging and Disability Services Division of the Department of Health and Human Services to establish a program to facilitate the transition of older people and individuals with a disability from a hospital to their places of residence. Additionally, the bill requires such a program to provide for collaboration between hospital staff responsible for discharge, the older person or person with a disability being discharged, and their caregivers, and to facilitate coordination of healthcare and social services for such individuals. And no amendments were proposed for this measure.
All right. Clarifying question or comment? Do pass, Senator Hardy. Second, Senator Harris. Any further discussion? Seeing none, all those in favor signify by saying aye. Aye. Any opposed? Senator Hardy, would you take this one?
Assembly Bill 345 is up next. It was heard in committee on April 29th. This bill excludes fentanyl testing strips, which are strips used to rapidly test for the presence of fentanyl or other synthetic opiates, from the definition of drug paraphernalia, thereby authorizing the delivery, sale, possession, manufacture, advertising, or use of such strips. During the bill hearing, Assemblyman Orentlicker proposed to add Senator Doniate as a co-sponsor of the bill, and following the bill hearing, he proposed the attached amendment.
All right. Any further clarifying questions? Got an amend do pass from Senator Hardy. Second from Senator Harris. Any discussion? Seeing none, all those in favor signify by saying aye. Aye. Any opposed? Motion passes unanimously. And Senator Hardy, would you take that one as well?
Assembly Bill 374 is next. It was heard in committee on May 6th. This bill creates a statewide substance use response working group within the Office of the Attorney General to review various aspects of substance misuse and substance use disorders and programs and activities to address these issues in Nevada. The bill also requires the Department of Health and Human Services to annually report to the working group the use of state and local funds to address substance misuse and substance use disorders, and it requires the working group to study, evaluate, and make recommendations concerning the use of these funds by submitting annually a report of its recommendations to the governor, the attorney general, the legislature, and certain other entities. During the bill hearing, Assemblywoman Tolles proposed adding one representative of a hospital and one representative of a school district to the substance use response working group, and these positions would be appointed by the attorney general in section 6 sub 2G.
All right. Any clarifying questions on this one? I believe each of the members had two additional members of the committee that they wanted to suggest. So we could really kick that number up there. I kid. Seeing no further clarifying questions, can I get a motion? Got a amend do pass from Hardy, second from Harris. Any further discussion? Seeing none, all those in favor signify by saying aye. Aye. Motion passes unanimously, and I will keep the floor statement on that one.
The last bill on work session today is Assembly Bill 430. It was heard in committee on April 27th, and this bill revises or removes certain obsolete terms to describe the provision of certain services to people with intellectual or developmental disabilities, and no amendments were proposed for this measure.
Clarifying questions? Seeing none, looking for a do pass. Do pass Spearman, second Hardy. All those in favor signify by saying aye. Aye. Any opposed? Motion passes unanimously. Senator Spearman, please take that floor statement. All right, with that, Ms. Kamlasi, we have made it through our work session. How about a little round of applause for Megan and Eric and all the work. Second committee deadline week in the bag. So I appreciate that. Of course, also shout outs to our committee manager, Nicole, our secretaries, Vicky and Norma, who keep us rocking and rolling. So glad to see that done. Congratulations to all the assembly members who had their bill make it out of committee today. I'm sure you have other bills alive in other places that you're trying to keep alive. So good luck with that. And we have just one more item of, well, two more items of business for today. We have our bill hearing. So I would like to invite up the presenters for SB 424. We'll open the hearing and settle in and just go ahead and start when you are ready.
Thank you, Madam Chair and members of the committee. It's nice to see all of you. And yes, congratulations, Megan. That was phenomenal. For the record, my name is Heather Korbulik, and I am here today representing Governor Sisolak as his policy director. I'm pleased to be joined today by my colleagues and two people I know I can call friends after the last year, Caleb Cage, who's Governor Sisolak's COVID response director, and Julia Peak, Deputy Administrator with Public and Behavioral Health. We are all honored today to be here to represent Governor Sisolak and present Senate Bill 424. I think I can speak confidently on behalf of the three of us when I say that witnessing the statewide collaboration in response to this historic pandemic has been enlightening and inspiring. If not for the dedication and sincere commitment from public and private partnerships, state and local public health workforces, nurses, doctors, medical teams, hospitals, first responders, HHS, DEM, the Nevada National Guard, the State Public Health Lab, and so many others that I can't go through the whole list, we may not have been able to realize the level of success that we can look back on with pride. In many ways, Nevada did what they always do over this past year. They showed up for one another, and even in the darkest hours, Nevada's battle-born grit and practiced resilience provided much-needed light. COVID has exposed so many of our state's strengths and weaknesses, and while we have demonstrated the ability to respond to a public health crisis of significant magnitude, we have done it with a frail and in some cases non-existing essential public health infrastructure. While we are able to respond effectively to this prolonged crisis, we have exhausted nearly every aspect of the statewide public health system. From the beginning of COVID-19's impact on the state, Governor Sisolak has been committed to examining the data and listening to scientific experts as he made decisions to balance the state's public health and economic needs. This commitment led to impossibly hard decisions with significant consequences and ultimately highlighted the state's public health workforce needs. One of the first lessons we learned is that public health touches every single thing. From HHS to DEM to the DMV, every single service of the state plays a part in a public health response. Back in April of 2020, Governor Sisolak released what was one of our first guidances, which is called the Nevada United Roadmap to Recovery, where he outlined the state's goals to recovery. One of those items was to turn this unprecedented challenge into a rare opportunity to transform Nevada's approach to governance, public health, education, and economic diversification. Right now, we have an opportunity to learn from this experience of this pandemic, to build a plan for a public health system that we need in our state, in an emergency or in our day-to-day efforts to serve the public health needs of Nevadans. Senate Bill 424, with the proposed amendment, creates a public health resource office in the governor's office to analyze the existing infrastructure for meeting Nevada's public health needs. The office will analyze the relationships between the people and entities involved in the provision of public health services, including local health authorities, providers of healthcare facilities, and not-for-profit groups. The role of the office is to identify and make recommendations to the governor and the legislature concerning the state's unmet needs. Opportunities and also opportunities to obtain federal or private funding to support public health services, and ways in which the state can improve coordination between providers of public health services and the delivery of those services. With that, I would hand the microphone to Caleb Cage.
Thank you, Heather. Good afternoon. Chair Addy and members of the committee, Caleb Cage for the record. Talk a little bit about the amendment that's proposed here today before turning it over to Julia Peak with the Division of Public and Behavioral Health. The amendment that we are proposing here today is relatively straightforward, whereas the previous version of this bill, the first version of this bill created this office within the Department of Health and Human Services, Division of Public and Behavioral Health. We're proposing an amendment that would remove this to the office of the governor. In all versions of the bill, the purpose of this proposed office has remained the same: to ensure that Nevada's overall public health infrastructure has a strategic vision for future improvements, and to ensure that best practices and lessons learned from the recent global pandemic inform this vision. And to ensure that actionable fiscal and policy recommendations are developed in order to pursue this vision as well. While these objectives remain the same, Governor Sisolak believes that they can be better achieved by making this office elevated into the governor's office. Elevating the Public Health Resource Office from the division to the governor's office will have the following benefits. Elevating this position also elevates the importance of public health and the discussion that we intend to have with this agency, which has long lacked strategic investment and support in our state, as my colleague Heather pointed out previously. Further, comprehensive public health is larger than one agency, and this amendment will allow for a whole of government approach in the future with respect to both day-to-day operations as well as emergency operations as a crisis response such as we've just experienced. With respect to day-to-day operations, the Public Health Resource Office can identify how all state agencies can best support improved public health outcomes by ensuring that it is not merely the responsibility of a single division within the Department of Health and Human Services. And during emergency operations, the Public Health Resource Office can identify opportunities to improve collaboration between response and support organizations like the state's Public Health Preparedness Bureau and the Division of Emergency Management. With that, I'll turn it over to Ms. Julia Peak.
Good to see you all. Thank you for the opportunity to provide testimony in support of Senate Bill 424 and the related amendment today. For the record, my name is Julia Peak, and I serve as one of the Deputy Administrators for the Division of Public and Behavioral Health. On behalf of the division, I want to start by thanking the governor for introducing this bill and for spending the last year and a half invested in addressing the needs of our public health programs statewide and ongoing support to make foundational improvements for the good of the public's health. Responding to the COVID pandemic has shown all of us the importance of a robust public health program. The Division of Public and Behavioral Health, or DPBH, the local health districts, and the counties have seen growth in public health capacity, but also have seen where improvement is needed. This bill will invest the funding and ensure dedicated staffing to assess and continuously improve our public health services throughout the state. This is a minimal investment for ongoing improvement. As you know, the Division of Public and Behavioral Health has very little general fund or flexible funding to support public health improvement efforts. Many of our efforts are categorically funded through federal grants, and that limits our ability to establish a resource office such as this and address known gaps in the system. Many of these gaps were known to us prior to the pandemic, and we also had ideas to improve those systems, but just did not have the capacity or dedicated staff to see these efforts through. That said, this Public Health Resource Office is a great next step to implement improvements and identify additional gaps and opportunities. Some of the efforts that our division looks forward to working with the Public Health Resource Office on assessing and implementing may include establishing an academic public health department in our state. An academic public health department, also known as an AHD partnership, is formed by a formal affiliation of a health department and an academic institution that trains future health professionals. This relationship is often described for our public health as the equivalent as a teaching hospital found between hospitals and medical schools. And I've testified in front of this body as well about what NSHE has done for us in the contact tracing and laboratory support, so I can't underscore this partnership enough, so it does need to be solidified. As is noted with an AHD, these partnerships can enhance public health education, training, research, and service that offer a variety of benefits for both organizations. They also strengthen the links between public health practice and academia, and to lessen the separation between the education professionals and the practice of public health. The next thing that I want to highlight is developing public health accreditation at the Division of Public and Behavioral Health. Again, I've talked about this to this body in the past, but to highlight, the Public Health Accreditation Board, also known as FAB, is a voluntary program that fosters health departments' commitment to quality improvement, performance management, accountability, transparency, and the capacity to deliver the 10 essential public health services. They're also committed to achieving the highest standards of public health. These nationally accredited health departments demonstrate a consistent and continued effort to strengthen community partnerships which enable better public health. There are 7 steps to accreditation: pre-application, application, document selection, etc. Just to reiterate, this is not a one-time thing, it's continuous quality improvement. Within Nevada, I'd like to acknowledge both Washoe County Health District and Carson City Health and Human Services are FAB accredited, and Southern Nevada Health District is well on its way. The Division of Public and Behavioral Health has not yet started, so again, I look forward to starting in partnership with this office. The last thing I want to highlight is assessing and establishing regional public health authorities. Nevada is only one of 2 states that operates a highly decentralized public health system. This means that most of our population is served by a local health department. Again, this is in Washoe and Clark County, and the remaining counties fall under the authority of our division. There's some latitude with delegation, and we've done that through COVID, but and the role of the county and city health departments, there's some room there, but we have a lot of room for improvement in this system, specifically to help create a better transition plan, a regional plan, that should they want to take on that authority locally. So I'll say lastly, with the Public Health Resource Office falling within the Governor's Office per the amendment, we are able to formally remove our fiscal note. So I don't know that that's noted in Nellis yet, but I wanted to make sure it was in my comments. That concludes my remarks, and I appreciate your time.
Thank you, Ms. Peak, with your fabulous first name. End of the presentation? All right, so before we jump into the presentation, I think it's important that we pause and just express our gratitude to the governor, to Mr. Cage, to Ms. Peak, to Ms. Korbulik for the tremendous amount of time, energy, literally blood, sweat, tears, health, illness, just so very many hours put into this response. And I know it took a village, and I know that you worked collaboratively with lots of folks across the board. But in terms of state folks, it is the dream team that you're seeing sitting here in front of you that took the brunt of it. And I just want to say that it did not go unnoticed, and that we, as at least the folks representing Senate HHS, but probably the entire legislature and the entire state, have noticed and are grateful for your service over the last 1.5 years. I know it took a personal toll, and so thank you. With that, questions on the bill. Senator Spearman.
Thank you, Madam Chair. And I echo the congratulatory remarks. I have a question. I've asked this a lot. The communities of color were hardest hit, both physically and mentally. And this seems like it is a really good opportunity to, if not have someone, and I know they're out there, from the BIPOC community, at least some type of cultural sensitivity in terms of addressing the needs. There were suicides in, I know, the Black community. I know that some were older and some were younger. But the response in terms of how do we get a handle on that, it was basically pastors and people who were trained in some type of mental or emotional health. So I want to make sure that we're looking at this from the standpoint of diversity. And I don't want to put him on the spot, but I know that Mr. Cage recognizes being a former Army person, correct, Captain? Army Captain? the strength that comes in a team when you have diverse voices at the table. So that was my concern then. That's my concern now. What are we going to do to make sure we diversify?
Yeah, Julia Peak for the record, and absolutely everything you said is truthful, and thank you so much for your comments as well, and for the support of our public health departments. I would say the public health system has been looking at disparities and trying to address it. For us, the establishment of an office to help us, and for me, it's going to Tina Dorch in the Office of Minority Health and Equity to help provide guidance to all my programs. So similarly, I'll just say the governor's office has been the same. Specifically that office and members of our community have been consulting with the governor's office weekly on how we can do better. The other thing that I'd like to highlight is we applied for a grant from our partners at the CDC. Then we should be finding out soon if we get it. That's entirely focused on diversity and disparity. And of note is also our rural communities. And so that entire award will be looking at embedding people within the community from the community to assess broad public health. And I'll just say that one of the challenges that we saw and knew was coming related to COVID was when you have comorbidities. And we know that our BIPOC community has comorbidities that if they got infected would have a more severe case. So it's addressing all of those things to make a healthier person. So getting better self-care for chronic disease, finding preventative services easier for the community and addressing that, but certainly getting people in the community information. And through the grant I mentioned, again, one of those things we're looking at is partnering with religious institutions, because that's where we can reach people, and again, embedding people like community health workers and promotories within the community to be our messengers. So all sorts of things will be coming, and I think this office, and they've shown it to date, is really interested in addressing the needs of our BIPOC community.
Thank you. And I guess I'm speaking specifically to the bill that's before us. Will there be any effort to do outreach to see if there are anybody, I'm sure there's someplace, from a BIPOC community that might be able to fill this bill? Don't hear that as me telling the governor what to do. I just know that most of the time when we see DHHS come before us, there's not a lot of diversity. And Ms. Peak, you are correct. In BIPOC communities, the comorbidities are off the chart. And that's why I have struggled the entire session to make sure that I have bills that are relevant, that speak to that, because it's not a matter of if, it's a matter of when the next pandemic will happen. High blood pressure, asthma, diabetes, all those things, and all of those things are really a part of the systemic racism. I'm not calling anybody racist. I'm saying there's a systemic racism problem. The CDC agrees with me. And if we're not real intentional about doing something about it, then it just continues.
I appreciate that. Heather Korbulik for the record. So I think I can confidently say that Governor Sisolak is committed to addressing disparities and the health inequities that we've seen that have just been amplified by this. And so this office will be committed to addressing those needs.
Is that with person or policy?
I think both.
Other questions? I think I have the more practical questions. We have an entire division that at least half of that is dedicated to public health, public and behavioral health. And I would make some arguments about behavioral health being public health. So on just the most practical level, how does this office and the governor's office work with the Department of HHS and the Division of Public and Behavioral Health?
Thank you, Madam Chair. Heather Korbulik for the record. So I think going to the 50,000-foot level, we absolutely intend to be very closely aligned with HHS on the projects that Julia outlined. But as I mentioned in my earlier comments, it is become incredibly clear to us that it takes every single state agency, and so we believe that pushing this position into the governor's office allows for elevated prioritization of working and authority necessary to work with all of those agencies and really get them on board with developing response efforts and working with local health authorities directly with the governor.
Other questions from the committee? All right. With that, we'll go ahead and open up public testimony. So I would ask the two of you to step back. And if there's anybody in the room who would like to testify in support of SB 424, come on forward. There's hand sanitizers and wipes if you'd like to sanitize.
Chair Ratty, members of Senate Health, my name is Connor Kane, Connorcain, and I'm testifying today on behalf of HCA, Sunrise, Sunrise Children's, Southern Hills, and Mountain View Hospitals in support of Senate Bill 424. Over the past year, our hospitals have cared for nearly 10,000 COVID-positive patients and ensured that Nevadans, including those in the most vulnerable zip codes, had access to free monoclonal antibody treatments. We, like many others, have learned a lot throughout the past year. As part of our efforts to continue to learn from the pandemic and improve our ability to serve our community, we strongly support Governor Sisolak, Ms. Korbulik, Mr. Cage, and Ms. Peak's efforts in Senate Bill 424. And we, like you, Chair Ratty, are also immensely grateful for their tireless work, sacrifices, and leadership throughout the pandemic. As we are hopefully starting to see light at the end of the tunnel, we think that the Public Health Resource Office will play a vital role to amplify our state's efforts to educate, test, and vaccinate our residents. Additionally, for many of the reasons Ms. Peak mentioned in her testimony, the Public Health Resource Office will pay significant dividends far beyond the pandemic, immeasurably impacting the lives of many Nevadans. Chair Ratty and members of the committee, we appreciate the opportunity to testify today and would urge your support of Senate Bill 424. Thank you.
Thank you. Anybody else in person who would like to testify in support of SB 424? All right, seeing none, we'll go to the phone lines. PPS, if you would help us, is there anybody who would like to testify in support of SB 424?
Thank you, Chair Ratty. Callers, if you'd like to testify in support, please press *9 now to enter the queue. Will the caller with the last 3 digits of 200 please state and spell your name for the record? You may begin.
Good afternoon, Madam Chair, members of the committee. For the record, Bradley Mayer, BRADLEY-MAYER, partner with Argenta Partners, testifying today on behalf of both the Southern Nevada and Washoe County Health Districts. The health districts are enthusiastic about this bill, and we appreciate the governor's office for bringing this concept forward, and we thank Ms. Korbulik for engaging with us in discussions around this. One of the things the COVID-19 pandemic has shown everyone is just how important public health functions are, not just to physical health in our community, but also to our economy. Public health and its partners, along with a wide variety of government agencies, have admirably risen to the occasion as Nevada has battled COVID-19 while carrying out all of their other public health responsibilities. I've worked closely with public health professionals at HHS and DPPH, especially Julia Peak, SNHD, and Washoe County Health District, and I'm always impressed by their knowledge, advocacy, and dedication to improving public health in Nevada. Our public health workers are really, truly some of the most passionate you will find, and they deserve our thanks for their work over the last year. We know Nevada ranks near the bottom on many important public health measures, and especially regarding to infrastructure. According to America's Health Rankings, Nevada ranks last in both state and federal dollars dedicated to public health, about $40 per person less than the national average. And according to a January 2020 report released by the Trust for America's Health, Nevada was ranked in the lower tier, along with 13 other states, for preparedness to protect the public's health during an emergency, scoring 3 out of a possible 10 in measures of public health preparedness for disease, disasters, and bioterrorism. And also in Nevada, we know that deaths owed to drug misuse, alcohol, suicide outpace the country. Rates of obesity and related conditions are high, and especially in diabetes. Nevada's STI rates are significantly higher than national rates, and we rank first for primary and secondary syphilis. We know we also have our challenges to mental and behavioral health, which have only been exacerbated by the pandemic, and we rank 51st for the higher prevalence of mental illness that we experience and lower rates of access to care. And 80% of rural counties nationwide reporting not even having a behavioral health care worker. There are several bills to address some of the issues this session, and public health is really grateful for this policy work. We've attempted to address some of these issues in previous sessions, most recently through the Public Health Improvement Fund bill from 2019, which was AB 97. That would have allocated $5 per capita, or approximately $50 million, to enhance foundational public health infrastructure statewide. We ranked, about 50th in public health funding, and we still would have ranked no higher than 48th, even with that investment. So it shows that we do have some improvements that we can make. But with all things, we understand this comes down to a matter of resources, and having an office such as this, focused on working with stakeholders to come up with solutions to strengthen our public health system above and beyond what we're already doing, will only help advance those discussions. We're really grateful for this piece of policy, and we ask your support of this legislation. Thank you, Madam Chairwoman.
Thank you, Mr. Mayor. Next caller?
Bill, the caller with the last 3 digits of 015. Please state and spell your name for the record. You may begin.
Thank you, Chair Ratty and members of the committee. Allison Genko, spelled ALLISONGENCO, with Ferrari Public Affairs, representing Dignity Health St. Rose Dominican, testifying in support of Senate Bill 424 today. St. Rose continuously works to address public health needs by focusing on the social determinants of health and finding ways to expand services in the Las Vegas Valley. We currently operate wellness centers, which are located at our neighborhood hospitals that offer free or low-cost classes to educate people on health-related matters, which include information about parenting, baby safety, diabetes, blood pressure, and exercise. We agree that in order to address public health needs, we must address the public health infrastructure first and foremost. St. Rose is proud to be a part of the public health infrastructure in Southern Nevada. We fully support finding innovative ways to bolster the public health infrastructure in Nevada, and creating the Public Health Resource Office will be a major step in that direction. Additionally, we would like to thank the Governor's Office for bringing this important bill forward, and look forward to working as a partner on continuing to address those needs. Thank you for your time.
Thank you. Next caller.
If there are any additional callers who have just joined us and would like to provide testimony in support of Senate Bill 424, please press *9 now to enter the queue. Chair Ratty, at this time, there are no additional callers wishing to provide testimony in support.
Thank you. We'll go ahead and see if there's anybody in the room who would like to testify in opposition to Senate Bill 424. Seeing none, BPS will go to the phone lines. Anybody who would like to testify in opposition to Senate Bill 424?
Callers, if you'd like to provide testimony in opposition to Senate Bill 424, please press *9 now to enter the queue. Once again, that is *9 to provide testimony in opposition to Senate Bill 424. Chair Ratty, at this time, no callers have indicated that they would like to provide testimony in opposition.
All right, we'll go ahead and go to neutral. Anybody in the room who would like to testify in neutral on Senate Bill 424? Seeing none, we'll go to the phone lines. Anybody on the phone in neutral?
Callers, if you'd like to provide testimony in a neutral position for Senate Bill 424, please press *9 now to enter the queue. Chair Ratty, at this time, no callers have indicated that they would like to provide neutral testimony.
All right. We'll go ahead and close public testimony, bring it back to the dais, bring it back to the sponsors. Any closing comments from the sponsors? All right. I will take the privilege of making one closing comment. I feel like I just need to give a shout out to all of the small, sometimes but mighty public health advocates who have been waving the flag on public health for as long as I've been in the legislature, and I would never say anything to diminish stepchildren, so I'm not going to use that analogy, but it has sometimes felt like public health is the forgotten health sector, if you will. And there have been a small, very dedicated group of individuals who've been waving that flag for a while, trying to bring that attention. So I am grateful to Governor Sisolak for creating this office. I hope it is a good first step forward toward realizing the hopes and dreams and vision of a much stronger public health sector in the state of Nevada, and turning around some of those statistics that show the lack of resources that we've invested in public health, and then therefore the lack of outcomes that we suffer in Nevada. So congratulations to the governor for taking this first step, and I look forward to hopefully all of us being able to work together to take it to the next level. So with that, we'll go ahead and close the hearing on Senate Bill 424, and we'll move on to our last item of business, which would be public comment. Is there anybody in the office who would like to make public comment? Anybody on the line who would like to make public comment?
Callers, to make public comment, please press *9 now to enter the queue. Once again, if you'd like to provide public comment for today's meeting, please press *9 now. Will the caller with the last 3 digits of 223 please state and spell your name for the record? You may begin.
My name is Emily Mimnaugh, Mimaugh. I'm a Nevada attorney testifying on behalf of the Pacific Justice Institute Center for Public Policy in opposition to AB 287. This bill raises significant and fundamental concerns about public and legal policy. The stated aim of the bill is furthering the welfare of pregnant mothers. Unfortunately, the bill strays far from its initial purpose. Instead of protecting mothers, it literally erases any reference to them 40 times over. The bill seeks radically to recast the definition of a parent-child relationship by eliminating not just the term mother, but the term father throughout the existing law. These changes are deeply problematic as a matter of public policy and as a matter of law. As a matter of public policy, the stated purpose of the bill bears no relation to this, quote, terminology revision, and simultaneously it denies the relation of a mother and father to their child. As a matter of law, the denial of a, quote, mother and father is inconsistent with the entirety of the NRS, which is, of course, replete with references to a mother and a father. This creates confusion and inconsistency. In a complete non sequitur, the bill deletes any reference to a, quote, mother. To achieve this, it performs dizzying, if not truly tongue-tying verbal gymnastics to offer 4 different vocabulary options, quote, as appropriate. The bill provides 4 new terms so that a mother can now only be called either a person who is pregnant, a person giving birth, a person who gave birth, or a person who has given birth, as appropriate. The bill transforms a father into, quote, other parent. The bill erases a child's mother from existence. She can never be a mother. She can only be a person who gave birth or has given birth or is pregnant or is giving birth. Legally, the current NRS certainly does not reduce a mother only to her status as either pregnant or birthing. If the goal is to rewrite the entirety of the NRS with these ironically ill-conceived and radical revisions, then this goal is also incredibly overreaching and impractical. We urge you not to make this Nevada law. Thank you.
Thank you. Next caller, and just a reminder that we have a 2-minute limit in public comment.
Thank you, Chair. If there are any additional callers who would like to provide public comment, please press *9 now. Chair Ratty, at this time, there are no additional callers wishing to provide public comment.
All right, with that, that concludes the business for the Senate Committee on Health and Human Services. It's looking very likely that our meeting on Tuesday, May 18th will be canceled. We, in theory, could get some bills introduced and that might change, but I think right now we're looking pretty confident that Tuesday will be canceled. If not, of course, keep an eye on the website. You would see an agenda posted. So with that, we are adjourned. Thank you, everyone.